Medical Monday. March is Colorectal Cancer Awareness Month, and joining me tonight to explain all you need to know is Dr. Eric Johnson with Aurora Bay Care. Now, Dr. Johnson, what is colon cancer exactly?
So colon cancer is a disease of the large intestine, and so that is broken down both into the colon and the rectum. The rectum is the last foot or so of the large intestine, but we combine them together because it's all the same part of the body, although the treatment is slightly different between colon and rectal cancer.
Now, treatment is a little different, but March is Colon Cancer Awareness Month. So what do we want people to really take away from this? Why is this so important?
Sure, I think for your viewers, the really important thing to know is that colon cancer is very common. It's the third most common type of cancer diagnosed in the United States. It can be very deadly. It's the second most common cause of cancer death. But if detected early, we can actually prevent cancer from forming altogether. If we see those precancer polyps on a colonoscopy, we can remove those polyps and it prevents cancer from forming.
Exactly. Detection is key in this case. So how exactly does the process go about? Do you want to kind of run me through it? Because this is something for mainly people over 50.
Sure. So most people that are average risk for cancer would be 50 and over. Although if you have a family history, there's a genetic risk that would put people a little bit higher risk.
Right.
Or if you're having symptoms, we'll do the testing sooner as well. There's a number of tests we can do. The most common and the most effective is a colonoscopy, which is a flexible camera test that lets us look inside of the large intestine. Nice thing is if we see something there, we can take a sample of it, we can fully remove it, and hopefully prevent it from forming cancer altogether.
That's where the preventiveness comes in.
Exactly. There are some other tests that are less invasive, so we can test blood in the stool, we can do some x-ray studies as well, but colonoscopy is the gold standard for finding cancers.
Now, if a cancer is detected during a test like that, what are the next steps? What do people do after that happens?
Sure, so we want to know a couple things. So we want to get a biopsy to know that it is truly colon cancer. Frequently we get a CT scan to make sure there's no spread of cancer to other parts of your body. And then we usually meet with a surgeon and we talk about how we can get this removed and hopefully be cancer-free for the rest of your life.
Now, we touched on some of the risk factors already, including family history, but what are some of the other ones that people should be aware of?
Sure, so age is the most important one, and we usually start testing at age 50, and if you have a normal colonoscopy at that point, then we go 10 years between the next study. Now, if you have a family history, we'll start testing sooner. There are certain other things like diseases like ulcerative colitis, Crohn's disease, other inflammatory diseases of the intestine, or genetic risk factors that would have us test you sooner.
Right, and then there are some symptoms that I wanted to touch on quickly as well that people could be kind of looking out for.
Sure. So abdominal pain is important, or a change in your bowel habits. That could be either diarrhea or constipation, blood in the stool, weight loss. Any of those things are worth talking to your doctor about. And it may not be that it requires a full test, but it's just important to get the conversation going.
Right, and that's what March is all about, getting the conversation going, because it is Colon Cancer Awareness Month. So definitely what you want people to take away from today is that it is preventable and it is treatable. That's what we're really looking at. So get your colonoscopy scheduled, right?
Very good.
All right,
Yeah,
thank you
thanks.
so much for being here, Dr. Eric Johnson. And for more information on scheduling your screening, you can call Aurora Bay Care General and Vascular Surgery. And we have all that information up on our website, nbc26.com.